Hi, my name is Nathan Myers with the Department of Political Science at Indiana State University, and I'm going to be talking to you about research involving the use of genetic sequencing for health surveillance and its relationship to hospitalizations at the state level. The research question for this project is whether early adoption of technological practices like genetic sequencing of COVID-19 samples in 2021 related to better health outcomes in 2024. In reviewing the literature, a number of themes were identified. The first is the use of genetic sequencing for surveillance purposes. It's noted throughout the literature that sequencing is a valuable tool for surveillance in that it helps to contribute to policy guidance in how to deal with disease outbreaks. However, it's often the focus of debate over protecting individual privacy versus the community's right to know. In regard to barriers, it's noted that logistics can be an issue in regard to transporting samples after they've been collected and things like that. For public health departments, having the appropriate equipment to engage in sequencing can create challenges, as well as being able to employ personnel who can effectively do the sequencing. In regard to trends, it's noted in the literature that sequencing can help to understand the effectiveness of vaccines. It's also been used to determine which segments of the population are more at risk from a virus or a variant than others. As noted before, sequencing and sort of the tracking of these things is often a flashpoint in privacy debates, but they're considered very valuable because it's important to determine the risks associated with different variants as they circulate throughout the community, as we've discovered a number of times with COVID-19. The final theme from the literature that I want to discuss is shaping policy decisions. Genetic sequencing has been influential in guiding policy decisions long before COVID-19. For example, during H1N1 in 2009, 2010, and Ebola in 2014 and 2015. It's contributed to increased understanding of transmission, therapeutics, as well as how to mitigate the effects of viruses. Next generation sequencing can be used to identify the most consequential variants, rather, to better target resources to the most severely affected areas, and is also used to determine the risks associated with those different variants. So genetic sequencing based on the literature is potentially a very valuable tool. So this research is going to focus on the public policy theory of the leader-laggard model, which says that some states are leaders in a particular policy area, while other states, often in their geographic region, tend to emulate them if the policies prove to be successful. So basically, the theory is that states that were early adopters of technology like genetic sequencing will see better health outcomes in subsequent years. The hypotheses, the research hypotheses here is that a higher percentage of genetically sequenced and published COVID-19 samples in 2021 in US states will be related to a lower level of hospitalization for COVID-19 infections at the state level in early 2024. And of course, the null hypothesis is that there is no statistically significant relationship between those variables. So I will be running a regression analysis. The independent variable is going to be the percentage of SARS-CoV-2 samples genetically sequenced and published in 2021. The dependent variable will be the state hospitalization rate for SARS-CoV-2 in 2024. And both of those variables come from the CDC COVID data tracker. Because I'm doing regression analysis, I'm including some control variables that come from the county health rankings data set. These include the percentage of smokers in the state, a variable measuring air quality, the percentage of people in the state who are obese, the percentage of people in the state reporting fair or poor health, the percentage of the state that is designated as rural, a measure of income inequality for the state, as well as a variable for the level of social associations in the state. So the bivariate analysis, just looking to see if there's a relationship between genetic sequencing and hospitalizations, does prove to be statistically significant. So the genetic sequencing has a negative relationship to hospitalization, indicating that more sequencing is related to fewer hospitalizations at the state level. However, in the full regression model, genetic sequencing, while still negative, is not statistically significant. Gini index, the measure for income inequality, is significant and positive, meaning that more income inequality is related to higher hospitalizations. And then the percentage of smokers in the state is also significant and positive, indicating that it is significantly related to a higher level of hospitalizations in the state. In regard to discussion and conclusions, genetic sequencing, while significant in the bivariate model, was not significant in any of the multivariate models, but its relationship to hospitalization rates is consistently negative, which suggests that there may still be something there for future research. Smoking and income inequality were both found to contribute to higher COVID hospitalizations, which means that personal behavior and socioeconomic conditions seem to be more powerful drivers of hospitalization than the use of genetic sequencing. However, it may be that if we look at a more applied approach in future research, such as wastewater sampling, we might get a better understanding of the true value of using genetic sequencing to try to monitor viruses and protect the public and prevent things like hospitalizations. So thank you very much, and I appreciate you watching my presentation.